Hey everyone. So you're here because you want a head start on the CNA state nursing test. So follow along. We're going to go over one of the mock exam tests that CNA Mastery Center has. Hopefully this can prepare you for the test and you'll feel a little more confident going in. So this is one of 11 mock exams that CNA Mastery Center has. So let's go over one of the first questions on the test. For a resident with dysphagia, the best position to minimize the risk of aspiration while eating is upright in a chair or elevated to 90 degrees in bed. When assisting a resident with walking, the nurse aid's position should be slightly behind and to the side of the resident. What is the primary purpose of the gait belt? To help support a resident while walking or transferring. When changing an unoccupied bed, which action ensures resident safety? Lowering the bed to the lowest position. A resident with diabetes has numbness in their feet. This condition is known as peripheral neuropathy. Which of the following is not a sign of an approaching death in a terminally ill resident? Increased responsiveness and energy. The primary reason for turning and repositioning a bedridden resident every 2 hours is to prevent bed sores or pressure ulcers. You are assisting a resident with oral care. They wear dentures. Which of the following is an appropriate action? Cleanse the dentures over a soft cloth or basin of water. HIPAA stands for Health Insurance, Portability, and Accountability Act. You are assisting a resident with eating and they begin to choke. Your first action should be to call for help and activate the emergency response system. To prevent infection, the most important measure is hand washing. When caring for a resident who has had a stroke, it is essential to encourage independence while providing necessary assistance. Which part of the hand should be used to check a resident's temperature by touch? The back of the hand. When communicating with a resident who has hearing impairment, you should speak normally while facing them to facilitate lip reading. The most appropriate method to identify residents is to check their identification band. If a resident is refusing a bath, the best approach is to respect their wishes and try to understand the reason for refusal. The acronym PPE stands for Personal Protective Equipment. To promote safety and prevent falls, it is essential to keep the floors dry and clear of clutter. What is the proper order for removing personal protective equipment, PPE, gloves, gown, mask, and goggles or face shield? When documenting care provided, it is essential to record information accurately and promptly. The Heimlich maneuver is used for a person with a blocked airway. For residents with diabetes, it is crucial to monitor for signs of high or low blood sugar. When providing oral care for an unconscious resident, the primary concern is preventing aspiration. Range of motion exercises are essential to prevent contractures and maintain joint mobility. Which side should a resident with a hemiplegic stroke be turned toward? Alternating between both sides. When assisting a resident with dementia, it is essential to use simple and clear language. What is the primary reason for using a gait belt when assisting residents? To support and steady the resident during transfers or ambulation. The Heimlich maneuver is used for a person with a blocked airway. How should you approach a resident with a vision impairment? Announce your presence verbally. If a resident refuses a meal, you should document the refusal and inform the nurse. For residents with diabetes, it is crucial to monitor for signs of high or low blood sugar. When providing oral care for an unconscious resident, the primary concern is to preventing aspiration. Range of motion exercises are essential to prevent contractures and maintain joint mobility. When assisting a resident with dementia, it is essential to use simple and clear language. What is the primary reason for using a gait belt when assisting residents? To support and steady the resident during transfers or ambulation. How should you approach a resident with vision impairment? Announce your presence verbally. If a resident refuses a meal, you should document the refusal and inform the nurse. Which is the most common site for checking a pulse on an adult? The radial artery. Which of the following is a primary sign of dehydration in elderly patients? Dark yellow urine. The best way to ensure that a resident's weight is measured accurately is to weigh them at the same time of day, preferably in the morning. A resident with a Foley catheter should always have the drainage bag below the level of the bladder. When a resident is on bed rest, which complication should the CNA monitor for? Contractures. When providing care for a resident with a hearing impairment, you should face them directly and ensure good lighting. A resident with congestive heart failure might be put on a low-salt diet. How should a bedridden resident be positioned to prevent aspiration during feeding? Fowler's position. If a resident refuses to wear a clothing protector during a meal, you should Respect their choice and provide assistance as needed. When a resident expresses sadness about a recent loss, the best response is to listen empathetically and offer comfort. Which part of the hand is often missed during hand washing? Fingertips. When transferring a resident from bed to wheelchair using a transfer gait belt, where should the CNA stand? On the resident's stronger side. A resident's plan of care should be based on the resident's individual needs. Which of the following is not a purpose of the resident's care plan? To serve as a disciplinary tool for non-compliant residents. If a CNA encounters an aggressive or combative resident, the first step should be to leave the room and get help if needed. Which of the following is the most accurate site for taking body temperature? Rectal. Proper body mechanics involve keeping the back straight and using leg muscles to lift. What should a CNA do if they find a resident's hearing aid on the bed? Inform the nurse and follow facility protocol. Which of the following is not a sign of potential elder abuse? Residents report of being treated well. A resident with dementia refuses to eat. The best approach for a CNA is to offer finger foods or snacks they like. Which type of fire extinguisher should be used on electrical fires? CO2. A resident's family member voices a complaint. As a CNA, the best response would be to listen attentively and inform the nurse. The Heimlich maneuver is used for a resident who is choking. A resident who is bedridden is at risk for contractures. Which of the following is the primary concern for a resident with congestive heart failure, CHF? Fluid retention. When providing postmortem care, a CNA should close the resident's eyes and mouth. Which nutrient helps with wound healing? Proteins. If a resident is experiencing a seizure, the CNA's first priority is to protect the resident's head. When should hand hygiene be performed? Before and after any contact with a resident, after touching any potentially contaminated object, and after removing gloves.